So, Namaskar, good morning, everyone. And here is Dr. Manish Yadav from Mumbai. And today I'm going to make a very short video where I'm going to discuss, we will talk about and discuss about something called as reflex symptom. Now, this reflex symptom is one of the terms that is being seen in many places in repertory, many places in MEDICA. What is the understanding of reflex symptom? What does exactly it mean? So whatever experience I have got, little experience in my practice with this understanding, I'm going to share with you. Of course, I'm not here the authority to talk about this completely, but I will share my learning and my understanding and how I use it in my practice. And this is a very important symptom to understand, especially about the remedies and the patients who are suffering from disease. Sometimes it can be your the thing that you're waiting for to crack the case. This is the thing that you have to understand. So reflex symptom. What does reflex means? So in if you go with a literal term like reflex, so I do something here, like problem is here, real problem is at one place, but the action and the result is seen at other place. That is called reflex. So maybe you give stimulus at some other place. The origin of the problem could be somewhere else, but the result and the manifestations of the symptoms are seen at some other places. Let me share you one case. And this was a case of one of my friend, a very close friend of mine. And suddenly he got a gallstone. He got gallstone colic and stone was diagnosed. Of course, he rushed to the hospital in the night, 3 o'clock, got some painkiller injection, came back. And then all the process started about the showing to surgeon and surgery or schedule and all those things with them. I had got 4 to 5 days at least to manage this case. And beautifully, I managed the case and complete gallstone got cleared. In this case, of course, there are a series of remedies which I'm not going to discuss. I gave one by one depending on the indication. I'm going to share you one of the acutes and one of the most important remedy that I prescribed in this case. And I think that was uh, the most important remedy to get rid of the organ damage, that is the gallstone colic. And in fact, the gallstone got dissolved by that. Within just, I think, he got relieved within 4 to 5 days. I managed it completely and it was resolved. So he told me a symptom in one of the acutes when I was following up in the series. He told me that his head, there's a lot of pain in the head. So now remember this, okay, try to understand. He's a patient of gallstone, diagnosed case of gallstone. He's into colic. There's a lot of, pressure and pain and all those things. The organ, if you talk about the sphere of action, the organ damage here, the seat of action is gallstone. Now this patient tells me, I've got severe headache, severe headache. Where is the headache? Headache is on the temple. Headache is on the temple. And from temple, it goes to the forehead. It goes to the forehead. And from temple, it goes to the eyes also. This is what he was telling. The temple pain going to the forehead, temple pain going to the eyes. So what I did is I opened my Kent repertory. So I will do exactly what I did that time and we'll learn from this. Okay. So my sheet. What I did is I opened Kent repertory. Okay. Go in location and head, you go in head pain, location, temple, temple. Then we have got extending. From temple, it was extending. You can see extending so many places. So it was extending to eyes and it was extending to temple. Sorry, forehead. Extending to eyes and extending to over forehead. So what I did is I started looking at the rubrics and the remedies, like to eyes, aloe, anti-improved, Asminia, I don't know what this is. Berberis, Cedron, Focus cacti, Gelsemium, Nantrum, phosphorus. Over the head, Allium cepa, Anacardium, Berberis, Borax, Param, Glonine, Hepa, Lilium fig. So many remedies. But when I was looking here, so it clicked to me that his headache, his pain is not actually a headache symptom. He is in the entire body, which organ is damaged or which organ is affected, his gallbladder. So I need a remedy which has action on gallstone. So I need a gallstone remedy. I need a remedy which has got seat of action of gallbladder, gallstone. And this headache which is there is not actually a headache, but it is a reflex of the disturbance of the primary seat of action or disturbance is the organ which is gallbladder in this case. So gallbladder is affected, hence the pain goes to the head. This is called reflex symptom. Body will always try to show you its remedy indication through symptoms. But many times what happens is that if you're just looking at symptoms superficially and you're not knowing pathophysiologically what is happening, what is deranged, which organs are affected, then you will miss the point. And the prescription that we make on our totality is very superficial. So what I did is that when I repertorize this, of course, Berberis, Phosphorus, so many other remedies, but Berberis came in the picture. And now you know Berberis. Berberis vulgaris. Correct? And all those things. Okay. Now say this. It is written. Wandering and radiating pain. So it has got pain which is radiating from one place to another. And pain in the region of kidney, hence it is used for gallstones. Cycle pattern. Of course, you can go and read the remedy. Okay. So what did you learn from this case? And of course, I gave Berberis, and after giving Berberis, of course, some few other remedies subsequently was given, but after giving Berberis, his stone got cleared and pain and agony, everything got cleared. From this case, I understood what is the meaning of reflex symptom. So when in MEDICA, they talk about reflex symptom. In simple terms, what are they trying to say is that you are seeing the result of the symptom at different organ or different place. Like suppose patient comes and talks about eye symptom. He has mental symptoms, headaches, and like in this case, he has toothache. And we will take the totality of that area and give the remedy. But we have to scan the case, the body, especially which organ is affected. Which organ is affected? From where is the primary disturbance? So primary disturbance could be at one place, means the organ which is affected, and from there you will find the reflex. This is called reflex symptom in simple terms. How do you understand this? So it's very crucial that in the case taking when you take, you always have to go back into the case. Like suppose a patient comes back into the case means you have to find out the evolution of disease. Means patient might come to you for neuralgia, patient might come to you for headache, patient might come to you for throat pain, backache. You take totality of that, but go back and ask, what are the illnesses have you suffered till now? Every minutest detail. When you went to a doctor, what medicines you take, why did you take? And then slowly and steadily, you will understand that this backache is now, but before backache, maybe a uterine trouble was there. Before backache, maybe she was suffering from piles. Before backache, maybe she was having urinary organ disturbance. Before backache, maybe dysentery was there, diarrhea was there. And the same organ is also affected right now. And hence you will find the reflex mechanism. This can also be one of the remedy symptoms of suppression also in a way. Like somebody gets a piles and that has been suppressed. It goes back to other organ. This is also reflex symptom. So in simple terms, if I want to explain you, reflex symptom means disturbance is at one organ, like seat of action, the primary source organ, but the manifestation is at some other place in the body. So body is trying to show a signal from other organ symptoms that don't look at my headache, my problem is in the gallbladder or uterus or like that. So many times migraine cases, right? And I have also struggled a lot with migraine cases in my practice. There are many cases that have been given good results, but I still struggle sometimes. And when I look back to those my failed cases, I always used to wonder that I have taken these cases with such diligence, totality was matching, everything was matching, symptoms were matching, modalities were matching. And why did patient did not get better? And it happens many times that your everything is matching, generals and everything, modalities, the patient does not get better. The reason is not your remedy is wrong. The reason is your you have not been able to give a remedy which has got action on the primary seat of origin, the origin of disease. Means in the body, patient comes to you with headache, but maybe headache is not the thing that you have to address. You have to address the organ affinity that Burnett talks about. Seat of action, find out where is the disturbance. So when you find out the disturbance in the body, from that you can connect and then you can understand it in a better fashion. This is called reflex symptom. Now let us go and study some of the examples of reflex symptom. How do we understand about this? I always tell to my students that please, whenever you are in doubt, now the only and the best way to understand homeopathy is go in literatures and especially materia medica and try to elicit it. Okay. What I'll do is that let's do a simple search. I put reflex in my sheet. Now what I do is that I'll open boric and I'll see boric. What are the remedies for reflex? Because in boric repertory, especially boric is one of the best repertories that has to be explored and best book, of course, you know that. So when you look at boric, there are many reflex rubrics. Reflex rubrics. Now we'll see one by one and try to understand. There's a rubric called head pain. Sorry, head pain cause uterine disease reflex. Now, how do we understand this and when to take this rubric? Means patient comes to you, and if you see the remedies, the underlying remedies are Semisifuga, sepia. There are other remedies too, but the important remedies are Semisifuga and sepia. What does that mean? What does that mean? It means the lady comes to you with headache. She's having headache, migraine. You're taking migraine totality, giving the remedy, partially patient is getting better, but the cause is not being addressed. Then you sit back and you think about the patient and you see that before headache or even at right time, there are some uterine diseases she has, or she had some uterine disease. There might be fibroid, there might be, some inflammation, ovary affection, tubal block, anything. It could be anything. Or some, DNC was done, some uterine disturbance was there. And after that got suppressed, or maybe that is also in agony right now, she's having headache. So now these are the remedies: Semisifuga, sepia, pulsatil, ignatia, but best is Semisifuga. So we'll read Semisifuga and try to understand the connectivity. So this is called reflex symptom, and that's how you give Semisifuga. You give the remedy, whichever remedy, not for headache. You treat the uterus because the problem is the uterus, the organ. From their disturbance, the reflex of the symptom is going to other organ. The manifestation is somewhere else. So manifestation is somewhere else. Now let us try and understand this part also. Let us understand other things. Face. Face pain type reflex from decayed teeth. So patient comes to you, and here the main remedy is MEDICA. I had once cured this patient with severe pain, neuralgia pain in the back in my clinic, at the center where I was working. One of the members, of the team came, and severe pain was there. The severe pain here on the right hand side or left hand side, I forgot. The pain was on the face. And when I opened and checked, so there was some disconnect. Okay. Severe pain was there. When I opened his teeth and saw it was decayed, the teeth was decayed. So there was no pain in the teeth. There was no pain in the teeth. The pain was there in the face, but it was the seat of the problem was decayed tooth pain was there in the face. And here I gave meserium, and with meserium wonderfully, of course, the decayed teeth had to be removed. Don't feel that meserium cured the decayed teeth. It was decayed very much. So he went for the treatment and all, but the pain, the way the pain got settled was amazing. Teeth pain, concomitant neuralgia leads reflex. Now, what is this meaning? Plantago is the remedy. So patient can come to you. Now we know Plantago is the remedy for toothache. We give so much. Patient can come in for pain in the lids, like neuralgia of the lids. The patient comes, suppose, talks about pain in the lids. Yeah, my eyes is paining. These lids are paining, and you're trying to take the totality. You will not get. You examine closely, you'll see that his teeth is affected. There is some decay in the teeth, and he'll say, I've been having toothache since some months. And that's a reflex going on in the list. And Plantago is there. Amazing. Right? Again, Simisifuga and Indian thing. Uterus disorders with reflex heart disease. What does that mean? So uterus is affected, but the patient comes to you with heart syndrome. And Lilium tick is a remedy. If you go and read Lilium tick, fear of organic diseases. It looks like arsenic. There's so much anxiety, palpitation, organic disease. It is open. It is open in selenium. It's a wonderful remedy actually. Mm, let's understand this. Mind. What is it here? Here some organic or incurable diseases. Okay. Other things are there. Forget that. But let's talk about it. Fear of organic and incurable diseases. When you go to urinary or female organ, so dark, clotted, offensive, flow only when moving about, bearing down sensation. So uterus is affected. That's what he's trying to say. When he's saying patient might come to you with heart symptom, patient might come and say, I've got some organic disease, I've got some organic disease. There's a lot of fear, panic inside. Palpitation is there. It means that this first that heart symptom has not come. First, the uterus got affected. So she will have menses irregularities, clots, pain, dysmenorrhea, menorrhagia, METERIA, whatever it is, some problem with the uterus. And after that, the palpitation and heart disease as a concomitant or a reflex syndrome. In fact, to understand ileum tape, we should open ileum tape here. In many places you'll find out, it is written here in Gogar, marked nervous hysterical reflexes, especially mental or cardiac. So all the mental and the cardiac, even the mental means the fear, all the other symptoms of ileum tape, the mental symptoms, tormented, and all the mental symptoms that you study about ileum tape, there's some problem with the uterus. The uterus would be affected. That's what he's trying to say. Can go down, down. Uterus. Okay. Female genitalia reflect symptoms from uterus. So many. So that's one of the things. Let's understand another. Of one more rubric I want to explain. Fever type reflects from local irritation. What I have understood about this is you might get a case where there is a fever. Okay, maybe pyrexia of unknown origin, or no, not unknown origin, of course. You can cite that there's some local irritation, there's some inflammation, something is there somewhere, and maybe antibiotics and other things were given, but that disturbance, the irritation is not going. Maybe there could be a pus somewhere, there could be a pain somewhere. Locally, one organ is affected. So you can use the Zupec and the remedies into that. Local irritation. Right? Now when we open Fatak is also very good repertory you can use and understand. Eyes reflect symptoms, heart reflects from, kidney, piles from. Okay. Let's open Google. I want to show you something. Look at Google. You can open any remedy and start. Google has given beautifully. So Aesculus, yeah, this is what I was saying. Reflex rectal syndrome. When you read Aesculus, what is written here in Aesculus? This. What does it mean? The first line he writes reflex rectal syndrome. What does that mean? Means in this remedy, the primary seat of action is the anus, the piles, rectum. Rectum gets affected, and from there you will find out the symptoms coming. Let us do it. I want to show you something. See this. I had given one patient this remedy on the basis of that. He says throat. In general, last line says throat with hemorrhoidal condition. It's like a concomitant. Somebody can say this could be a concomitant thing. Yes, it could be a concomitant. You can understand in that fashion also. But how beautifully is written. So patient comes to you with your throat complaint, pain, agony, whatever, and you're taking totality, giving heparin, spongia, this, that, other remedies. That's okay. Patient might get better, little bit, not better. And then you examine or you ask about the evolution, what else you have disease, what are the illnesses that you have suffered in the past, and you find out that he is a habitual patient of hemorrhoids. Or some hemorrhoidal complaints were there recurrently. He took some treatment, suppressed it. So throat complaint is not actually when patient comes for throat complaint in this case, it is not the problem in throat. The problem is in the rectum. That organ is being affected, so the manifestation is got on the throat. Like in Barbaris gallbladder, it went into the Barbaris went onto the head. Lilium takes semicifuga, uterus went onto the heart and the mental symptoms. This is how you understand. Okay. And of course, you have to go and read different remedies out of it. I'm not going to talk about everything, but like Naja, platina is very important remedy. You have to understand this remedy also. He says many various override and uterine reflexes. Let us study platina. Many of various symptoms reflects from ovaries and uterus or sexual organs. Voice aphonia, hysteria, or reflex associated with uterine care. Let us see what Chaudhary has to say. Mental condition is like that of later remedy, like he's comparing palladium here, sort of reflex of ovarian or uterine complaint to which she is chronically married. So guys, what I understood in nutshell, let me conclude this lecture. This was just a short glimpse, just to give you an idea, so that you go ahead and you can explore your own ways and study. Many a times when we are looking at the mental symptoms or the predominant symptoms, we might miss something if we don't understand the pathophysiological correlation. We have to go deeper and find out what is the pathophysiological correlation. Take the present totality, but always try to look behind. As we have spoken in the myasm lecture also, that Hahnemann always said that don't look at the totality, look behind. What is causing it? So that's how you understand the main cause. The cause which is seen right now is not the main cause. It could be some other cause that is causing the main trouble. So look behind, go into evolution, past history, how the disease started, which was before this disease, what disease was there, before that, what disease. As you keep exploring back and back and back and try to elicit the evolution of it, slowly and steadily you understand that the organ is affected is something else, and the symptom which is manifested in some other part is the reflex symptom. It is not the symptom of the organ which is in trouble, like Asculus, Lilium Tech, Naja, Simisifuga, Barbaris, so many remedies with it. I hope this short video makes sense to you, and this is just a glimpse of it. Please go read, and if you have something good, please share it to the world, and so that we can learn from each other. Thank you very much.